Good day. Thanks to everybody who's joining. We will start promptly at 1 o'clock. Great that you're here. That's 1 o'clock Washington, D.C. time. Okay. I'll wait another minute. I see people are still trickling in, so we'll give it one more minute and we'll start at 1:01. Okay, great. As other people join us, I hope other people will continue to join us. But I'd like to welcome you all to this session today on Beyond One Size Fits All, meeting the sexual and reproductive health needs of adolescents with disabilities. My name is Cate Lane. I am the Director of Adolescents and Youth at Family Planning 2030. For those of you that don't know, FP 2030 is a global partnership which is intended to increase women's and girls' access to and use of contraception and family planning services, inclusive of adolescents. And in the last couple of years, we've begun to pay much more attention to underserved groups that are not well reached by current family planning service delivery programs. And one of these priority populations is people with disabilities. And I'd like to give a little shout out to FCDO, the British Aid Agency, which has really been the standard bearer, I think, for encouraging greater attention to and support for people with disabilities to have access to sexual and reproductive health services and to have safe, healthy, and pleasurable sexual lives. So thank you so much to FCDO for really being out there as a strong advocate for people with disabilities. So as I said, we are focusing more of our attention on adolescents with disabilities, as I am the Director of Adolescents and Youth. And in 2019, we had some money from FCDO to begin to think about ways that we could better support adolescents with disabilities to obtain sexual and reproductive health services. So we were able to award a small grant to Pathfinder International to take a training manual that it was in the process of finalizing to add a more inclusive approach and to ensure greater inclusivity of the manual to all people, but also with a very specific focus on adolescents with disabilities. And the manual has been finalized. I think we can drop the manual link in the chat. Perhaps Marta can drop that link in the chat. But we're very, very pleased that this tool and resource is now available to providers around the world who would like to better understand how to be, number one, more inclusive in their approach to young people, but also to have a little bit greater sensitivity towards meeting the needs and preferences of adolescents who are living with disabilities. So we are going to start today with a moderated discussion between Marta Pirzadeh, who is from Pathfinder International, and with Alessandra Aresu, who is with Humanities and Inclusion. As I said, we awarded this small grant to Pathfinder International. Pathfinder, in turn, decided to work with Humanity and Inclusion, to help provide this more inclusive lens and this more disability-friendly lens on the manual. So we're going to have this conversation, a little bit of a conversation between Marta and Alessandra about how they partnered, what some of the benefits of the partnership were, and what are some of the things you all can learn about leveraging each other's strengths to better meet the needs of underserved groups, including women and girls who are living with disabilities. So Alessandra, maybe you could introduce yourself.
Thank you. Thank you, Kate. Good morning, good afternoon, and good evening, everybody. I'm Alessandra Aresu. I'm the Director for Global Inclusive Health at Humanity and Inclusion. Some of you may know the organization under the old name, Handicap International. And I'm myself a specialist on gender, sexuality, and disability. And I'm very happy to be here on the behalf of the organization and to talk about this partnership and why partnership is important to promote inclusive SRHR. Within the world of inclusive health, some of you also know me as the co-chair of the Inclusive Health Working Group of IDDC, the International Disability and Development Consortium, and also the co-chair of the Inclusive Health Working Group of GLAD. Back to you, Kate. Thank you.
Thanks. And Marta, would you please introduce yourself?
Sure. Thanks, Kate. Thanks, Alessandra. Hi, everyone. Good afternoon. Good evening. My name is Marta Pirzadeh, and I am a senior technical advisor. What's my job? I'm the Senior Technical Advisor for Adolescent Youth Sexual and Reproductive Health and Rights at Pathfinder International. For those of you that aren't familiar with Pathfinder, we are a sexual reproductive health and rights organization, global organization. We're currently working in 19 countries around the world, although over the past 65 years, we've been in over 50 countries. Our primary goal really is to ensure that we believe that access to quality healthcare, including family planning, is not only a fundamental human right, but can also transform the lives of women, families, communities, and nations, really. And so as we get more into our discussion around partnership, I'll help describe sort of how important it is for us to reach young people, but also young people who are often, as Kate mentioned, underserved or marginalized, and in this case, with a focus on inclusive sexual reproductive health and rights services.
Thanks, Marta. And so just a second, we will go into our moderated discussion. Before we start that though, I just wanted to make sure, Elida, is there any housekeeping stuff that we should share with folks before we continue on with our discussion?
Hi, Kate, thank you. We do have a transcript available for those of you who would like to follow along that way. If you go to more and hit show full transcript, you should be able to view that. We also, as you can see, have interpretation into international sign language. That's it from my end. Back to you, Kate.
Okay, great. Thanks. And thanks so much to our interpreters and our closed captioner. Okay, so let's just dive right into this, shall we, Alessandra and Marta? Okay, the first question. Well, first of all, we're going to have a couple of questions that I'm going to pose to Alessandra and Marta, but we do have a chat box, and we do invite you to drop your questions into the chat box while Marta and Alessandra are talking. And if we have some time at the end of this segment of the webinar, we will pull some of those questions from the chat box, because I find actually the questions you all have to ask are oftentimes way more interesting than anything I have to say. So but we'll start with a couple of high-level questions for Marta and Alessandra. And my first one is around partnership, and Family Planning 2030, it bills itself as a partnership. And this is something that I think that we're all recognizing is we need to work together. We need to collaborate better. We need to leverage each other's strengths. And so partnership is really the best way of doing this. And so I'd like Marta and Alessandra to talk a little bit about what do you see as some major benefits? What was the benefit for Pathfinder to establish this partnership with Humanity and Inclusion? Similarly, Alessandra, what have been the real benefits for Humanity and Inclusion around establishing this partnership with Pathfinder? And I think I'll start with Alessandra.
Perfect. Thank you. Thank you, Kate. Well, first of all, I would say that Humanity and Inclusion really believe that partnership is key to promote inclusive sexual and reproductive health and rights for many reasons. And in fact, all of them are reflected in the partnership with Pathfinder International and with FP 2030 that we are discussing today, that both of the organization have been crucial for the success of this work. And the first reason is that a partnership can count on complementary strengths and commitments coming from the different partners involved. So complementarity is the first keyword I would like to for people to keep in mind, because complementary strengths allow each of the partners to give their best rather than trying to do everything on their own, with the risk of reinventing the wheel. So in our partnership, for example, we could count on the long-term experience in the field of sexual and reproductive health and rights for young people of Pathfinder, and the strength of a donor like FP 2030 with the long-term experience in supporting the SRHR of young people that were clearly aware of the importance of inclusive SRHR, but back in 2019 being at the beginning of their journey when it comes to disability inclusion. And both Pathfinder and FP 2030 have understood really that the objective of making their action disability inclusive cannot be achieved by hiring a consultant to sprinkle some disability inclusion on their work, and that the need to join forces with an organization with a long-term experience on inclusive SRHR like HI that made available a team of 4, including one person with disability, to work on this partnership was essential. And in fact, the success of this partnership comes really from the fact that we all contributed with our best resources, an existing and solid Pathfinders training manual that needed to be revised, and an HI team specialized on disability, gender, and age inclusive health, well equipped with knowledge on disability inclusion and expertise on SRHR. So a combination of SRHR expertise and disability inclusion only without the strong expertise on inclusive health, for example, would have not provided the same quality results. And so this approach allowed the HI team in coordination with the Pathfinder team to integrate the inclusive health perspective throughout each of the chapters of the manual, and to add a dedicated chapter on disability inclusion and youth with disabilities, and to establish a rich technical dialogue and exchange that led to the manual that is now available for the use of all, that is in open access. And really rich technical dialogue is the other key word that I would like for people to keep in mind. The second reason is that working on inclusive sexual and reproductive health and rights means much more than working on disability. We know that the factors that prevent or facilitate the access to sexual and reproductive health and rights information and services are many, and include, for example, age, gender, sexual orientation, economic status, literacy level, just to mention some. And so the partnership with Pathfinder allowed us to work at the intersection of these different factors rather than one by one and separately. So the third keyword that I would like to everybody to keep in mind when we talk about partnership, it's really intersectionality. And I could continue more in speaking in such a passionate way about the partnership and why partnership is important, but I will pause for a second to make sure that Marta can add on this specific point and then move on with the next set of questions. Cate, thank you.
Thanks, Alessandra. I also just wanted to make a point of clarification. Thanks, Elida, for putting this in the chat box. But when we refer to SRHR, that means sexual reproductive health and rights. So I know we all tend to speak in acronyms and jargon. So for those of you who are new to this conversation, I apologize for not being clear in what it is we're talking about. So yeah, so Marta, same question for you. What were the major benefits for Pathfinder in establishing this partnership with Humanity and Inclusion?
Sure, thanks, Cate, and thanks, Alessandra. I think Alessandra mostly covered it. I think that the benefits were mutual for all the organizations involved. But I think from Pathfinder's perspective, as I mentioned in my introduction, Pathfinder has a 65-year history as a sexual and reproductive health and rights organization. And so that's our primary focus. That's the expertise that we bring into the communities where we work. And, you know, when we are establishing or implementing such programs in communities where we're working, we really want to make sure that the voices of those people that we're trying to reach are being heard and are being included within our program and services. And so in this, you know, for example, if we're doing a program for young couples, we would want young couples, we would want to, you know, really prioritize young couples in the planning and implementation of the program. And in this case, we know that young persons with disabilities have unique needs, and they also have the same sexual and reproductive health rights and needs of other young people. So we wanted to be sure that we partnered with an organization that understood those needs, that was going to work with us to identify the barriers, and, you know, that we weren't making any assumptions about the needs or the rights or the interests of persons with disabilities. And so partnering, as Alessandra said, was complementary for all of us, that we all were able to bring the strengths of our organizations together and work together to ensure that this resource is how we first began the partnership, that the resource and all of our follow-on opportunities were not only broadly appropriate to reach all people with sexual reproductive health and rights, but that if there were unique needs of certain populations, that we would understand those and be able to include that as well. I think that covers it with what Alessandra said.
Thank you so much, Marta. I just wanted to add in a couple of thoughts that occurred to me as you both were speaking. And I've worked in adolescent sexual and reproductive health for 30 plus years. And one of the things we've been begging for since ICPD in 1994 and even before is more integrated holistic programs. And I've often seen what sometimes the response to those holistic integrated programs is one institution tries to do everything. So you have a health facility that says, oh, young people need job skills, so we'll do income generating skills as a way to get them into the health services. And it oftentimes pulls away organizations from the things that they do well, which is from the perspective of a sexual and reproductive health organization, what they do really well is provide services and generate demand and provide information. But they're not necessarily the best organization to think about inclusivity and meeting the needs of specific populations. It's not enough just to go in and have a focus group discussion with a community of people living with disabilities. So there lies the benefit of partnering with an organization like Humanity and Inclusion, because they bring a wealth of experience and insights into how to work with people with disabilities in respectful, equitable ways to ensure that their needs and their preferences and their sexuality is respected. So I'm a huge fan of not trying to do it all ourselves, but if we work together, we are greater than the sum of our parts. Okay, the second question I'd like to pose to you both is, what advice would you give to other organizations that are looking to create similar sorts of partnerships? And maybe thinking beyond sort of advice, what are some of the actions that you felt made that partnership most effective? And we'll go ahead and start with Marta this time.
Sure, thanks, Kate, and thanks for that follow-up. That was great. I think building upon what Alessandra said a few minutes ago about understanding and identifying complementary strengths within partners is really key. I think whenever we at Pathfinder are looking for partners, we are often seeking partners that can fill in gaps and be complementary to ours. We know that we are bringing the decades of sexual reproductive health and rights work and experience, but that we have gaps in other areas. And so we are searching for partners who can complement the work that we're doing, but also that align with our organizational priorities and values, and working with organizations that are closest to the people we are trying to reach. So oftentimes we will be for example, looking toward partnerships that are youth-led, if it's a youth or a youth project, or women-led, if it's a gender transformative project, or in this case, working with, you know, an organization that works directly with persons with disabilities, is going to certainly strengthen the partnership. And I think, you know, Cate said, asked what some of the actions made this partnership work most effectively. To be honest, I think Cate's point was a great one about not trying to do everything, and that many times organizations or individuals within organizations don't have the humility to know that we need to step aside and allow someone else to take leadership in this portion of the project or this activity. And I think we did that well. Both Humanity Inclusion, Pathfinder, and FP 2030 all knew what our strengths were, and we were able to pass over, you know, the expertise in other areas to the other partners. And together, as Cate said, all three came together to be a very strong partnership. So for us at Pathfinder, when we're looking for organizations to partner with, we don't look for an organization that does exactly the same work that we do usually. We're looking for one that will enhance the work that we're doing, or reach a new population, or, you know, expand upon, you know, fill in the gaps that we as an organization may have. Thanks, Cate.
Thanks. Alessandra, I'd love to hear your perspective as well.
Thank you, Cate, and thanks, Marta, for starting this reflection. I would like to add among the tips and advices that we can share with the people who are with us today, with the different colleagues. First of all, I would say think long term. Placing your inclusive sexual and reproductive health and rights activities for the partnership that you want to establish in a roadmap, building each other and building each other's each step and actions on the previous experiences that are part of your journey. So do not think at each partnership in isolation, but think them in a long in a comprehensive roadmap as a journey, because each partnership will teach you something. We will give you the opportunity to learn something that it's very valuable for the next steps. As an example for us, after establishing this partnership with among the three organizations, ICPD Plus 25 came, and this partnership among the three of us allowed HI to partner with FP 2030 to bring a delegation of 14 young persons with disabilities at ICPD Plus 25, something that we would have not been able to do without the additional support of this donor. And also we worked together, the three of us, to make sure that they could participate with training before the ICPD Plus 25 that was really to promote the skills of young advocates that without our partnership would have not probably brought an including perspective to this activity. And especially now we look back and we are thinking where to go next. I also want to highlight that one of the speakers in the youth panel that we will listen to later on in this program is one of those young people. Her name is Yumna, and you will hear from her directly. And then the second point that I want to make is that expect that each of the partners have to learn at each step of this journey, because the partnership between mainstream and disability focused actors in SRHR is fairly recent. Is a recent experience. And while the focus is often in the debate, in the discussion on how the mainstream actors have to learn how to work with disability-focused organizations like HI or OPDs, like the one that Pathfinder partnered with in testing the manual at the country level and then implementing the action of using the manual. Well, very little has been said about the what organizations like HI or the Organization of Persons with Disabilities needs to learn how to, when it comes to work with mainstream organizations or with donors that are new to partnership related to disability inclusion. So again, a key word is a common understanding of priorities and constraints from all sides is necessary to make sure that each one of us learn how to develop this partnership and work together. And the third advice is maybe do not underestimate the time and resources needed to work on disability inclusive SRHR and plan wisely and in advance, because rich technical dialogues among different actors require time and resources, and we all have learned it by doing it. With Pathfinder and FP 2030, we really find ourselves thinking that, well, the time was never enough to make it, to finalize the work. And it was a great experience, but we felt sometimes that the time was not on our side. And a couple of additional points before giving back to you the floor, Cate. One point to highlight is on the budget that allows the meaningful participation of persons with disabilities and their representative organization. Make sure it's available from the beginning. If not, you will end up looking at this aspect as an addendum of your work, while this is and should be at the core of your work. And also in this case, we are never ready enough to do this from the beginning, and there is a lot to learn. Of course, think in advance about the differences between disability-focused initiatives and disability-inclusive initiatives. This will allow you to anticipate the intensity of the work of each partner and to deal with the expectation of each partner. For example, in our case, a disability-focused manual on inclusive SRHR for young people with disabilities only would have been a very different manual from the one we have that is for all young people, including persons with disabilities. I will stop here and back to you, Cate, for more comments and questions from the public.
Well, and that's a great point you just made, Alessandra, because one of the things that we are really engaged in doing is talking about the importance of partnering with young people, moving away from this kind of meaningful youth engagement to more sort of intentional, trust-based, equitable partnerships with young people. But we really do have to keep in mind that we have to continue to remind ourselves that young people are not homogeneous, and we really must be partnering with a diverse and inclusive range of young people. So when we are, engaging in consultations with young people, we need to be not just talking to the university students who are based in the capital, who have easy access to meetings and so on and so forth, but be thinking about how we can reach people with disabilities or people living in marginalized circumstances, so we have a much better, broader understanding of the needs of all young people. So, and starting with this, people with disabilities and adolescents with disabilities is a great place to start, because unfortunately, disabilities remain common in a lot of the places where we all work. I think I'm going to ask if anybody in the audience has any questions for our two panelists. If you don't have any questions right this minute, don't hesitate to drop them in the chat box as we proceed. But if there are no further questions, I think we can definitely save a minute here and move on to Kaela. So I don't see anything in the chat box, sort of hello people that have joined and are introducing themselves. Thank you. But let's move on to Kaela Lutrell. Thank you.
Hello, everyone. Hello, everyone. My name is Kaela Lutrell.
Hello.
I am deaf. And I just graduated from Gallaudet University with a degree in public health. And now I'm working as a preventative. A COVID prevention manager here in Washington, D.C. So I'll be your moderator today for the next questions. And I have a few questions. And I'd like to first address my question to Zekia, and then Shangwe, and then Urma. So first I'll let Zekia introduce herself.
Thank you so much for me being here again. I want to really thank Humanity and Inclusion Mission in South Sudan first, and with the very closely partnership that is Pathfinder organization. My name is Zekia Musa Ahmed. I'm from South Sudan, HI. Probably I'm working as a WISH inclusion assistant in WISH project, that is Women Integrated Sexual Reproductive Health. And also I am an advocate on the rights of persons with disabilities. I work with OPDs. There I'm a secretary for Women with Disabilities Network. I worked as a 14 years with people with disabilities before I joined HI. Thank you so much.
Thank you so much, Zekia. I would like to introduce now Shangwe. Can you please introduce yourself?
Thank you. Thank you, Kaela. Good afternoon and good evening, all of you. My name is Shangwe Kimath, and I'm a public health officer, currently working at Pathfinder International in Tanzania as a program officer responsible for gender, youth, and social inclusion. I'm a person without disability, but implementing a program that a program to promote disability inclusion, specifically in sexual and reproductive health and rights. I'm motivated and ambitious to ensure communities, especially adolescents and young people with disability, are accessing quality and friendly sexual and reproductive health and rights. Martha has introduced a lot about Pathfinder International, but I'll say a little bit in Tanzania that we are implementing, we are part of two consortiums programs, that is Advancing Youth for Life Skills, funded by the USAID, and the Scaling Up Family Planning Project that is funded by the FCDO. All are implemented to ensure that we are promoting sexual and reproductive health and rights among young people with disability. So this is short about me. Back to you, Kaela.
Wonderful, thank you. And our last panelist I would like to introduce is Yumna. Go ahead and introduce yourself.
Thank you, Kaela. Hello, everyone. This is Yumna Manga Omar from Zanzibar Island, Tanzania. And I'm a teacher by profession, but also a founder and chairperson of All About Albinism Campaign Association. It's a non-governmental organization that aims on advocating for the rights of persons with albinism here in the island. But I'm also a member of Zanzibar Global Fund Country Coordinating Mechanism for Disability Constituency. As a person with albinism, I also advocate for diversity and inclusion and was awarded at the Outstanding Youth in Social Work back in 2019 from the Zanzibar Youth Awards. Thank you. Before I forgot, I'm the one that Alessandra said that I participated in the ICBD 25 during 2019 in Nairobi. Thank you.
Wonderful, thank you. And thank you for introducing yourself. Let's go ahead with our first question, which is for Zekia. So do you think that one size fits all when it comes to sexual and reproductive health rights and young persons with disabilities? Can you share with us your experience with accessing SRHR?
Hello?
Hello. Did someone else want to address the question?
Sorry, I just got disturbed by the network, so I want to know that if I'm in. Sorry. Thank you.
Yes, Zekia, we can hear you.
Okay.
Yep, we can hear. Did you get my question, or would you like me to repeat it? Zekia?
I didn't get your question because I got disturbed by the network, and just confirming that if I'm in or not.
That's fine, no problem.
Yeah.
So the question is, do you think that one size fits all when it comes to sexual reproductive health and rights and young persons with disabilities? And can you share with us, do you think that one size fits all when it comes to sexual reproductive health and rights and young persons with disabilities? Can you share with us your experience with accessing SRHR?
Okay, thank you so much. Actually, just to, before actually I shared my experience, I really want to thank HI again because, you know, humanity and inclusion, it's really done a very great mission in South Sudan. And actually I'm not defending because I'm working in, but this is what I really witnessed. Before I joined HI, we have been advocating on the rights of persons with disabilities, but not enough. And still barriers here and there, but through HI actually, even me now, I'm speaking, I'm able to address the issues of persons with disabilities is because of HI and the organizations who come out with the issue of the inclusion. My experience on sexual reproductive health services, or to access the services of sexual reproductive health, actually in our country, we have many kind of obstacle that hindering persons with disabilities in accessing these services. And we have to know that Convention on the Rights of Persons with Disabilities, it stated very clear that persons with disabilities, they have to participate actively, fully, with in an equal basis with others. We have to participate in every aspect, in every kind of the services, you know. So, and this convention I'm talking right now, unfortunately, even the convention is not being signed and ratified by our government. But this is not a turn up. This is not a keeping silent, I will say it, because as an advocate and as an activist of persons with disability, and especially a visual impairment lady, I have to make sure that even if I'm not able to achieve the goal of convention should be signed, tomorrow my colleagues who are coming after me, they will do that. So because right now we are seeing the changes and the policies that is now at least is able to make people with disabilities to access services freely, like international disability and inclusion policy, education inclusive policy. These are all comes from the Convention on the Rights of Persons with Disabilities. And this is great achievement actually by our government also. As I said earlier, that some obstacle actually hindering persons with disabilities, especially the attitudinal barrier. So this attitudinal barrier actually, it's right from the family, the health workers even by itself. And this one actually created a lot of fear and panic even for persons with disabilities to go by themselves to access the services. Because if you go to one of the facilities, for instance, and you want to, maybe you are not going there for family planning, you're not going to you know, take the contraceptive. But first, when the health worker, one of the health worker look at you, first, are you coming to do what? And you're someone who is having an impairment. You know, do you have boyfriend? especially when they use the adolescent. Do you have a husband? This is now for the ladies who are 18 above, maybe 25, something like that, because this is a marital age. So such kind of this question, it is embarrassing for the women with disabilities, and that's why sometimes even if to go just for information on the sexual reproductive health, they will not go, because they are going to challenge with those questions. So this is one, the attitudinal barrier. Then the negative perception also, right from the I said earlier when I was asked that to share my experience today, that actually we have a culture that we believe in our culture that you will not talk about the sexual activity, especially with the adolescents. And when you are talking to them about the sexual activities, which means you are encouraging them to do something which is not right, you know. And secondly, family planning by itself, it is a prostitution exposure, you know, it is a prostitution exposure. So for this, no right for someone to talk about the family planning. Leave about the religious leaders, they have their own thinking on family planning. Those all actually prevent our young women with disabilities or young female with disabilities to really access those services, because you have that right, you have that culture that this family planning, it is a prostitution exposure, and plus the negative perception that you as someone with impairment, you don't have right, you don't deserve this, so you will just be there at home. And that's the issue that we're able to realize, and we are able to conduct a FGD with those people, even if they have their different thinking. We want to know, we want to consider that thinking actually is in place, and so that we can be able to change a little bit. I really don't know, I've gone more, but actually that's how I will just stop here for a while. In case of any question, then I'm still, I will add something a bit. But before, just to end, just a short scenario one day when I was conducting an FGD with one of the health workers. So someone was telling me that first, you, the organizations, you are actually encouraging sometimes, you know, you are encouraging havoc for people to go and access family planning, though they are not family, because this family planning, it is meant for the families, you know. So now you're encouraging ladies to go and access family planning. For her, actually, any ladies come to her facility, she will chase the lady away. Then I ask her, now, do you understand the meaning of family planning? Yes. Why I not understand the meaning of family planning? Of course, it is for family. Then I was like, okay, now this lady is originated from the family. She was born by a mother and a father. So she has right to go and access that family planning. And if the lady comes to your facility, don't chase her away. Maybe she's not coming to access the family planning. Maybe she's coming for the information, because our mothers, they are not friendly with the ladies. So you have to be there as a friend, like a teacher, because I was a teacher also. So I know when the ladies are coming from the background, they don't know anything. So it is us who will teach them here outside. So even if you are a nurse, you have to tell information very correct, and then the lady has to choose either to use the family planning or not, because family planning is not about the contraceptive things, you know. So that is where I was really discussing with her. Even she's like, now she get convinced, because I was like, now one day I went to the facility for the HIV department. And though I'm not going for the HIV test, we need today awareness workshop on HIV. So when these people of HIV saw me, they're like, this is a vision impairment lady. Now she's coming. Who is the one injured her with this impairment that she has? You know? So why actually this lady is being injured like that? So the doctor was taking to me, you know, now these people who are talking to you, who are talking about you, because here we have a culture that every people with vision impairment, especially, they are not hearing also. They can't see and they will not hear. So they will talk louder. So the doctor was like, now these people are all they're having file in their hand, you know? So when I discussed with the doctor, I'm now coming out from the facility, the same, they said, oh, this lady, maybe she's coming for something different, you know, because you can see there is no file in her hand. So the same thing I narrated to this nurse. So I was like, now, when someone just saw me like this, and someone will talk negative things about me. You see, I saw Zekia there. She is actually entering to HIV. Maybe she's having HIV. And yet I'm just coming to discuss, I'm coming to see a consultant to come and teach us about the HIV. The same thing, when this lady is coming to your facility, you have to leave her. Maybe she's coming to ask for the information and she's coming to, and then you have to narrate to her everything, and then she's the one who will choose whether to use or not. So this is the scenario, and actually this is what our nurses believe here on us. And this is a big obstacle actually to persons with disabilities here in South Sudan. I will stop here for a while.
Thank you so much, Zekia, for expressing and sharing your stories. So I'd like to address the next question to Shangwe. What do you think needs to be done to promote disability inclusive sexual reproductive health and rights? With whom and with whom to collaborate with?
Okay, thank you, moderator. Thank you for giving me opportunity to answer the question. And actually, Zekia has explained a lot about the challenges that young persons with disability are facing in accessing sexual reproductive health. So my question is, what is need to be done? A lot has to be done, but I'll answer the question using two sides. That is the demand side, demand creation side, and the strengthening the supply of services. On a demand creation side, here a lot has been is to be done to ensure that young persons with disabilities are aware of the full range of sexual and reproductive services available at the localities, as well as to assure them. A lot has to be done to ensure some activities has to be conducted to ensure that, to assure young person with disability, to assure them with friendly environment when they will reach the facilities to access sexual and reproductive health information and services. As well as we have to create demand for them to link them to services from the facility or from the communities to the health facilities. Now, I'll be using the current programs which we are implementing in Tanzania, the scaling up family planning interventions or activities and the advancing use activities as a case study. First, we have to train, or we have trained community health workers on inclusive, on disability inclusive, whereby community health workers who are used as a linkage between the communities and the facilities or providers for a person to access health services are trained or oriented to provide, first to mobilize a young person with disability, as well as to provide services or mobilization services to young persons with disability. So first activity that need to be done at the demand creation side is training the community health workers. But also we have to identify the peers or champions from the communities, maybe from the communities where young people with disabilities live, and train them on disability inclusion, whereby we have identified champions from the universities and colleges and communities where young persons with disability live, to engage them, and training them to impart them with the knowledge and skills to transfer sexual reproductive health and right informations to their peers who are young person with disability. But also, we have to ensure that there is a proper linkage from their communities, from their associations, to the health facilities which are providing friendly sexual and reproductive health information. After strengthening these referral systems, we have also to track. We have to track the referrals to ensure that the referrals are successful to the health facilities or health delivery centers. apart from the demand side, we have a lot has also to be done on the supply side to ensure that we're strengthening the service provision and uptake of service of sexual and reproductive health and services and rights among the young people with disabilities is strengthened. Here, a lot to
Looks like we've got some freezing here. We can wait a minute and see if the Shangwe will unfreeze and then proceed, or we could go on to the next question. Let's see if he will be able to join us. Okay. So we'll wait for him to come back in, but proceed to the next question. I'd like to address this question to Yumna. How can healthcare providers make a difference in enabling young people with disabilities to access sexual reproductive health and rights? SRHR.
Thank you so much for this opportunity. But before I go directly to the answer, I would like to summarize a little bit on what Zekia had said on that young people with disability usually faces multiple barriers ranging from gender, type of impairment, rurality, poverty, social support that hinders them in their realization of sexual reproductive health services. This is a work of multiple stakeholders, but to answer your question, for the sake of the healthcare providers, on my opinion, is that they should increase resources for disability inclusive services provision. And when I speak of resources, it includes both human resources and accessible facilities. Starting with human resources, this includes building capacity to healthcare service providers on diversity and how to communicate to young people with disability. We have had some of the examples from Zekia and experiences in our community. It is these healthcare service providers that do discriminate young people with disability when they seek information or go to search for the services in the healthcare centers. This is because of, as they said earlier, attitudinal barriers, negative perception, knowingly, unknowingly, intentionally, or unintentionally. I believe that if people know better, they do better. So if we build their capacity, train them, give awareness and understanding on diversity and and how to communicate with people with disability, it will ensure a significant differences on young people with disability to access their sexual reproductive health services. There are a number of young people with disability who are being left frustrated, gaining little knowledge, and reluctant to go back to the healthcare centers in search of information and services just because of the discrimination and those we're expecting give us knowledge, understanding of our, in reality, it is opposite. So as government stakeholders and healthcare service providers, the professionals, building the professionals and building capacity, trainings, understanding will help in increasing a significant differences. But also on the part of accessible facilities, these include toilets, ramps, sign language interpretation, visual communication boards that would allow us to access information on the right time, because sometimes we do get information late, and the information, if the information delayed, then it is a result of a number of this discrimination, and for us to not receiving our sexual and reproductive health rights. But if we get that information on a particular time needed, that will bring a tremendous significance for us in accessing our social and reproductive healthcare services. Thank you.
Thank you so much, all three of you. Thank you for answering the questions and for being willing to share your experiences. I think we've learned a lot from what you've shared. And I feel that this shows that it is so important to have inclusion in SRHR. So before I give the session to Cate, I just wanted you to know that you can always share more questions in the chat if you have them. All right, thank you. And now it is to Cate.
Thank you so much, Kaela and Yumna and Shangwe. I'm not sure where you went, but we were really interested in what you had to say. And Zekia, I mean, I've heard Zekia speak a few times. She's always an incredibly passionate advocate for people with disabilities and young people with disabilities. So really, really insightful conversation about the individual challenges, and also just what your observations and your experiences in working with people with disabilities. We have a few questions that have been posed in the question and the chat box. And I'm hoping that all of our panelists will be able to weigh in on those responses. In fact, I'm not going to call on anybody, but I'll pose the question. Then if people want to simply raise their hand or indicate that they're interested in responding, we can do that. One of the first questions that was posed was, what are, in your opinions, what are the greatest barriers that adolescents with disabilities face in expressing their sexual identity? And I think that's even just a bigger question than just their access to sexual and reproductive health services. Alessandra and I have had this conversation a few times, is oftentimes we really don't see people with disabilities as sexual beings. And I'm sure people with disabilities would very much disagree with that framing. We're all sexual beings. We start in the womb as sexual beings, and we are sexual beings until the day we die. So I'd love to hear from our the two sets of panelists about what your perspective is on what are the greatest barriers. Obviously, provider bias is one, but there are many others that perhaps you might want to elevate or reiterate based on your conversation. So anybody want to take that on? Okay, I will call on somebody then. Yumna, would you like to share your perspective?
Pardon, please, I didn't get the question.
The question is, what, in your opinion, are some of the greatest barriers that young people with disabilities, adolescents with disabilities, face in expressing their sexual identity? And my comment on that was, I think this goes beyond their ability to access sexual and reproductive health services, but even just to express themselves as individuals that have sexual needs, preferences, desires. I see Zekia has raised her hand, so maybe we can go with Zekia and then come back to Yumna, if that's okay. Okay, so Zekia, why don't you go ahead? And then, so we'll have Zekia, Yumna, and Alessandra. So we'll start with.
Yeah, thank you so much. And actually, thank you for the audience questions. The greatest barrier is when I was sharing my experience I say it very clear. The main barriers actually are that hindering the participation of persons with disabilities, especially accessing the SRH, that's the attitudinal barrier, especially here. And actually, this attitudinal barrier is covering more. It's covering discrimination, it's covering the cultural belief, it's covering the what, you know, this attitudinal barrier by itself is connected to all other barriers that we are able to identify that are hindering persons with disabilities from the participation or getting the services. Not just SRH, but every kind of the services even, you know. So, and then the physical barrier. Why I say so, the physical barrier, because this is actually related to the impairment that we have. I want to go to one of the facility. The facility is not accessible to me. The doctor even is sitting higher, maybe in the highest building, and the building even doesn't have lift, you know, and I'm someone who is having a physical impairment, and I'm someone even is a hearing impairment. Nobody will be able to communicate with me. Nobody even is you know how to translate my language. And actually, this is what the biggest gap we have here, according in our country. The communication barrier is really something, a very big gap. And that's why my request, actually, we need many donors to come and stand with organizations who are really promoting the inclusion, because it is really a lot need to be done, especially in the communication. Right now, I'm talking to you. In my country, we have 4 sign language interpreters. And in our country, we have over 10 states, you know, and each state, some of the states, they are having 8 counties. Some of them are having 11 counties. All those states, they are having OPDs, Organization of Persons with Disabilities, which mean they have right to access the services, and while the interpreters are not there. So actually, a lot need to be done in the issue of, you know, improving the communication so that it will not become barrier to our sisters and brothers who are hearing impairment. Leave along the visual impairment, things are not really accessible. There is no speech, you know, in some developing country, you will see even the lift can speak. You know, when you want to go to the second building, this lift even can read for you the building that you want to go on. But still, people are just, you know, improving it a bit here in our country because of many talk shows that we used to do, many meetings with the stakeholders we used to do. So we can see a bit of change, but still not enough. So actually, that's the issue. Those are the barriers actually that are contributing into, you know, exclusion of persons with disabilities from accessing the services.
Thanks, Zekia. That was a really comprehensive response. One of the things that it makes me think about is, you know, we work within health systems that are not particularly client friendly. It's, you know, and we'll talk about that a little bit more, but there's really a need to continue to work with health systems and healthcare providers to be a bit more client-centered in their approach, you know, so health services aren't there for the convenience of the provider. Health services are there to meet the needs of the client. So Yumna, I didn't mean to put you on the spot, but if you wanted to weigh in, fine. If not, we can go on to Alessandra. And Alessandra, why don't you go ahead and share your perspective? Oh, wait, Yumna, you're coming on?
Yes. I'll add a little on what Zekia had said, that there's also no confidentiality. Because of those barriers, those who are able to access the services, they have to be there with a third party, which remove the confidentiality. And these things need confidentiality between the doctors and the person with disability themselves. But because the healthcare providers, they lack knowledge on sign language, interpretation, and things like that, there has to be another person who will communicate. And that's a big problem. I feel I'm not safe. My personal things are being exposed to someone else, which is not good. That's it.
And that's, you know, that's something we've been talking about in the adolescent health field for many, many years is young people feel that the services that are provided to them are not confidential. And it just implies sort of a disrespect on the part of providers, assuming that it's okay to talk about people's private business openly because, well, they won't care or they don't know or they can't, whatever. So it really is incumbent upon us to continue to work with providers to really demonstrate respect for the clients, regardless of age, parity, marital status, disability, et cetera, et cetera. So every client is unique and deserves to be treated with respect. Alessandra, I'd love your insights as well.
Thank you. 2 quick points. The first one linked to what Yumna just said. It bridges very well with the importance of highlighting informed consent, not only confidentiality, but make sure that everything that young people in general and specifically persons with disabilities, any service they receive is received after they have expressed their consent, and that consent is collected in a way that has allowed really people to understand what is that service about and the treatment about, and make sure that they have the opportunity to express their consent in a very inclusive way. We can spend another webinar on what informed consent means, but as today we don't have the time, I at least want to put that out there because violation of the rights to informed consent is a key discussion that we need to have every time we talk about inclusive SRHR. Back to the question on the biggest barriers in expressing sexual identities among young people with disabilities, I would say sexual identity and gender identity that come together. Because the intersecting factors that we were discussing about are here also very important. We can see that not only a young person with disability has faced all the barriers that our colleagues, especially young people, have shared, and I will not speak on the behalf of them. But what we have not said is that when a young person not only is looking for information and services in the field of, in the sector of SRHR, but is also coming to these services with a gender identity that is not matching with the gender norms. So is not is not in a, for example, in a heterosexual couple, breaks the rules of heteronormativity out there. That is the additional barrier that young people with disabilities face. A young person who is a part of the LGBTQI community already, as a person from the LGBTQI community, face challenges, discrimination every day. If we add to the barriers and to the discrimination that a person from this community face, the fact that there are additional factors related to their gender and to their disability, the result is that the barriers multiply rather than duplicate, even they multiply. So when we think about why and how these elements and the gender norms and the sexual norms that are really shaping up our life and our exchanges on sexuality really apply fully within the context of inclusive SRHR. And I will pause here because I know we don't have the time to get into more details, but I thought this was a good way to come to the, going back to the intersectionality perspective and come to the end of our exchange. Thank you.
Thanks, Alessandra. And I just wanted to point out that there is a question in the chat that asks specifically about guidance around for consent and disability inclusive health services. So if you have a resource or some material, obviously informed consent is incredibly important for any person, regardless of disability, in terms of their access to family planning services. But if there's any specific guidance around people with disabilities, I wanted to also, I'm going to ask, we're going to pose this question to Shangwe in a minute too, because I'm so glad you're back, Shangwe. But one of the things that I've observed over the years in having worked in a family planning clinic many, many years ago is family planning, healthcare providers are usually swamped. They see a lot of clients coming in first thing in the morning, and we know young people, for example, often take a little bit longer in counseling, and you layer in all these other variables, disability, shame, stigma, what have you. It makes it more challenging for people perhaps to articulate their needs or their preferences. And so sometimes providers will just assume their silence implies a consent, if you will, and they will go ahead and make decisions for them. So again, it's really important that we're continuing to work with providers to understand and help them develop skills in having conversations and having counseling and dialogue with individuals that may not be able to come in and within the first couple of minutes of a provider interaction say, I'm here for this, I want this, thank you very much. So Shangwe, the question I wanted to pose this to you as well, since you're back, is in sort of what have you observed as some of the greatest barriers that adolescents with disabilities face in terms of expressing their sexual identity? I don't know if you had any thoughts on that, or if you'd like to pass, we can simply go on to the next question. Okay, and we'll just go on. The next question that was posed was, what are some examples of good practices to address the sexual and reproductive health of adolescents with disabilities? And I liked your question. I forget who asked that question, but I feel the same way. Oftentimes we spend a lot of time defining the problem and not—
I'm not getting you clear. My audio is not getting clear.
What's that? What was that? Okay, we'll just keep going, and Shangwe, you can jump in when, and I think I'd like to hear this, Shangwe's response to this as well, is what are some good practices? Obviously, I think Shangwe had mentioned training in his presentation. Yeah, of course it's rainy season, and so, you know, fix your electricity and your internet connectivity. But anyway, so good practices beyond just training providers, because training providers is really just a first step in a long continuum of things that need to be done. So let's see, who'd like to start with? Is there anybody that would like to take that question? Marta, do you want to?
I'll jump in just for a little bit. I think there are many different examples, and I do think Shangwe was starting to get to some of them when we lost him. But I think what I want to highlight, and part of what this panel is about, is what a good practice is. This is not very concrete, but I think it's really critical to reiterate, is the importance of partnerships, the importance of working with organizations or people that identify with the population that you are trying to reach. I think that, you know, of course, we could train health workers and providers on, you know, to minimize bias. Of course, we can work with, you know, champions in communities and youth champions and all of those things, conducting, you know, life skills sessions, for example. But I really think engaging with the communities that you are trying to reach is critical as a best practice. And, you know, having their input as to what would work. Like even today, we're hearing from Yumna and Zekia some of the barriers that they have faced. And as a representative of a sexual reproductive health and rights organization, I'm listening to them and thinking, okay, what could we do to overcome some of those barriers? How can we link young people with disabilities with facilities that do have lifts, for example? Or how can we work with universities to ensure training, you know, to support the training of interpreters? So I think partnerships is really a key to some of the success, in addition to clearly outlining, as somebody asked about, some, you know, guidance and you know, when developing resources, for example, an organization like Pathfinder, which is a mainstream, you know, international nonprofit, we can be thinking about inclusivity in all of our you know, development of resources, and not assume that everybody can read. Maybe we need to do some audio, maybe, you know. So I think it really requires us taking a different lens, and I'm sure there are other on the ground examples, but for me, you know, from a global perspective, I think partnerships are really a key to ensuring that the voices are heard of the young people we're trying to reach.
I would certainly ask our young representatives to share their perspectives as well about what are some examples of good practices that you have seen that have done a good job at providing sexual and reproductive health services to adolescents with disabilities. Go ahead, Zekia.
You know, before I just answered the question, I want to make sure that one day, this webinar, I will not participate it online. I want to go there, either Washington, to go and see actually how persons with disabilities are advocating and how they are doing, they are promoting the inclusivity, accessibility. So, because this is one of the good practices. Mm-hmm. Right now, currently, the question with the achievement that we are doing as a good practices, as in our WISH program, or Women Integrated Sexual Reproductive Health program, we are doing outreaches with the service providers and inclusively with those people. Even we are going with them to the talk show. And some of them actually, they're able to highlight their experiences. Like before, they don't know actually things to do with the Washington group of questionnaire. But now if someone with impairment comes to her or comes to him, he will able to ask this question accordingly to the impairment that person has, you know. So they are really, now they are implementing the Washington group of questionnaire right into their facilities, especially the facilities that we used to have linkages with them in accessing the family planning and plus the training that some people are saying about it. So we have to train, you know, not just OPDs alone, but we have to train people without disabilities to speak also on the rights of persons with disabilities, which means we have to have the networking, sharing of information, exchange visit. These are all actually can promote, and it can protect, and it can even, you know, make the life of persons with disabilities at least will be free from some of the barriers that are hindering their participation. So the good practice, actually, this is what we are just doing, the outreaches, the talk shows, and plus the training that we are making for them, especially the health workers. And these are actually, it's helped us a lot in getting their experiences on the work of when they are working.
That's a really good point, Zekia. And you know, one of the things I've observed over the years is healthcare providers often reflect the biases, the values, the perspectives of the communities that they work in. So it's not that healthcare providers alone hold these biases against adolescents with disabilities or people with disabilities seeking sexual and reproductive health services. So we also need to change the dynamics in the communities where we work so that providers feel comfortable providing services to all people and don't feel like they themselves might be stigmatized or marginalized because they are choosing to provide services to a population that the community frowns upon, perhaps. Alessandra, would you like to weigh in?
Yes, thank you. Thank you, Kate. I want to build on something that Zekia said before, referring to building the capacity. And I would of everybody who needs to advocate for inclusive SRHR. And for me, we need to use a keyword here that is facilitate the empowerment of young people, no matter where they live or where is what is their profession and profile, because projects starts and comes to an end with the funds of great donors and great partners. But then when we finish a project, the important thing is that young people with disabilities who have been working with us and accompanying our work every day and being core part of that project will be able to, with or without international NGOs and donors, continue that work. And this happens only if within a project there is, first of all, space for facilitate and support the empowerment of young people, and secondly, support and facilitate the capacity building of the representative organizations of OPDs. If we do not allocate funds for this, the risk is that we do not make our actions sustainable. And then there is someone has asked for documents. I'm including a link in the chat. This comes from a project that Zekia has referred to, that is the Women Integrated Sexual Health program. HI is only one partner of a big consortium led by IPPF and with many other partners. And these are lessons learned that have been collected, and the document is available and open access to everybody. And of course, behind the scenes, the donors is once again FCDO that has been supporting all of us in the partnership that we have been implementing so far, and that once again is investing in improving access to young people to sexual and reproductive health and rights. And we heard today that the commitment remains for the future. So we look forward really to continue being supported by donors like FCDO. Thanks, and back to you, Kate.
Thanks. And I know Shangwe is having trouble with his connectivity, but he did drop a comment in the chat box about reaching young women at antenatal care, or I believe it was at antenatal care clinics. Let me double check. But the point there is we need to reach young people where they are. Okay, so they reach young women by aligning with the outreach services of postnatal clinic schedules, because young mothers rarely miss those, oh shoot. Sorry. Sorry, I clicked on something and all of a sudden the camera was gone. So young women come for postnatal services. And so this is a great place to reach young women that are already coming to a service, and whether they're disabled or not. And this is where you can reach them with information and services. And then we only have a couple more minutes before we need to close, but there was one final question. And I think it's a little bit of a controversial question, I guess. And the question was really about, you know, in many countries, we simply struggle to provide sexual and reproductive health information and services to all adolescents, regardless of disability. And so how do you raise awareness of the importance of reaching adolescents with disabilities and provide services for adolescents with disabilities in a context where it's not necessarily acceptable to provide services to any adolescent for family planning? And one of the things that kind of occurred to me when I was reading that question was, well, you know, I don't think we want to go we certainly don't want to go the route of creating separate standalone services for people with disabilities, because we've tried that with young people and those approaches are simply not sustainable. You can't take them to scale. And in some respects, some young people feel those are equally stigmatizing, because if you're seen going to a youth-friendly clinic, everybody knows that you're going to the youth-friendly clinic for. So we don't want to do that, but this brings me back to my point about trying to do a better job of helping providers to become more inclusive, more accepting, more client-centered in their approach. But I thought it was an interesting question, so I'm wondering what all of you, the respondents, think of that. You know, we can't reach young people, so why should we be expending special effort to reach young people with disabilities? So I don't know who wants to take that on in the last 5 minutes. Or maybe we just leave that as a rhetorical question.
Maybe Kate, I would.
Go ahead, Alessandra.
My automatic answer is because young people with disability are young people.
Right.
First of all. And so why reach young people with disabilities? Because first of all, they are young people, and therefore their rights are the same of everybody, no matter where they live, no matter what they do for living, and no matter how far or how difficult it is, how difficult it is to reach them. So, because if we focus on their disability before focusing on their young, or being girls, of being from an ethnic minority.
Disability does not define
then
them.
we miss
Yes.
the point.
Yes.
The disability is only one factor that do contribute to their identity and to their lives. But if we only focus on one factor, it's like focusing on me saying that I'm Italian. Well, it's not enough to identify myself as a full person. And so I think that is the first thing that maybe we should say in answering that question.
I totally agree with you. And I think if not, we shouldn't be trying to split up the adolescent population. I mean, we do know that different young people have different needs and different preferences, and we should be responsive to what young people need or want, but we shouldn't define people by their disability status, just as we shouldn't be denying young people contraception because they're not married or they haven't had a baby yet. So it really is being focused on the needs of the client writ large to ensure their good sexual and reproductive health, and need to be peeling off these other variables. Zekia, you have a comment?
Can I add a bit?
Absolutely.
Yeah, Alessandra said actually persons with disabilities because they are young people. And for me, actually, I will just quote her point, and I will just add that, yes, they are young people, and also they are part of the community, part and parcel of the community. So with this, if the community accessing everything, every kind of the services, including SRH services, persons with disabilities must be there. And also we have to know that SRH is a human right. So, and persons with disabilities, of course, I'm a human being. I'm not someone else. So this is my right, and I have to access freely, you know, and I have to be, if things need my concern, people have to, people have to inform me. I have to be informed. Where is the clinic? What are they doing? You know, such kind of those things. So actually, this is what I will just quote her point, and I will just add on that. It is part of my right as being part of the community. So with this, it is my right to deserve these services.
I couldn't have said it better. And I think I would like to end this webinar on Zekia's comments, unless there are any other burning comments or perspectives anybody would like to share. Other than that, I really appreciate the great conversation that we've had today. We've also seen some wonderful comments that have come in the chat box, tremendous amount of interest, I think, in the topic. Really hope you all can take some of the discussion we've had here, as well as the tools and resources in your work with adolescents, whether with disabilities or not, but in particular, because this is a global summit on disability, that we're really using this as an opportunity to raise the profile of adolescents with disabilities and ensure that their needs that our responses are inclusive of young people with disabilities, as well as the diverse range of all adolescents. And I see Zekia wants to say one more thing. Go for it.
Actually, today I'm very, very, very happy to participate in this webinar, and yet I'm participating, yet the project is really ending. So mine is just a request, actually, for you, our biggest people there. Really, you have to think much to advocate really seriously, so this project will be success. And I'm sure, you know, when actually people working with people with disabilities, everything will be, especially the blessing will be flowing like a river. So I want to make sure to really, Alessandra has do something so that money can come more. And we need to consider, you know, because the project is ending and capacity building is not really enough to persons with disabilities. HI alone cannot do that. So we really need many donors to come in and continue with this really reproductive health program. Thank you so much.
Thank you, Zekia. And the last thing I'll say before we close out is, some of you may be aware that FP 2030 we are devolving to a regional hub structure. Our work has been centered in the DC area for the past 8 years, and now we are moving to a regional hub structure. So please keep your eye out for when these regional hubs are announced. because I really hope that the disability inclusive community is going to be putting some pressure on these regional hubs to be building in a focus on adolescents as well as people with disabilities from the outset. One of the things I've seen happen over many, many years is we start a program where we stand up an organization, and then a few years down the road, we say, oh, well, maybe we should have more of a focus on young people, or maybe we should be paying more attention to people with disabilities. These things need to be baked in to the organizational structure of these regional hubs as they're being stood up. And that is incumbent upon our civil society partners, our organizations working with people with disabilities to put the pressure on these regional hubs to ensure that the needs and the perspectives of this community is taken into account. So I want to thank everybody again for all of your contributions. And wherever you are, enjoy the rest of your day, evening, and hopefully we'll meet again in some different place. Thank you. And the webinar.
Thank you so much. Thank you.
Thanks.